Hey everyone, good day to all. Myself, Dr. AJ Moria. Today I'm going to discuss, guys, 100 plus one-liners from the pharmacology, guys. Okay, so guys, pharmacology is going to be very easy subject. Okay, now just you have to just study five drug names and their action and their uses side effects. That's it, guys. It's going to be very easy. Five drug. Okay, one day five drugs. Okay, so guys, and also running the Telegram channel. I'm just conducting the MCQs and discussing the topics in the Telegram. This is a FMG aspirants by Dr. Ajay Moore. Okay, Dr. FMG aspirant, Dr. AJ. Just a search in the Telegram, you will get it. Okay, so without any delay, let's start the discussion. Okay, so guys, the first question is that pneumocystis gyrovesi. So guys, for the drug of choice for the pneumocystis gyrovesi and also for the isospiribelli, it is the cotrimoxazole. It is cotrimoxazole. Okay. So guys, for the erectile dysfunction, it is the sildenafil PDE5 inhibitor. In the females, guys, who having the less sexual activity, and then you can give the flibanserin in the females. So guys, remember here for the sildenafil, guys, you have to avoid for sildenafil. You have to avoid the nitrates. Okay, you have to avoid for the patients who are using the nitrates for the chest pain and also who are on the hypertensive drugs. You have to avoid this sildenafil. Okay, because it causes the most severe hypotension. There may be chance of the death also. Okay, so next question is the so guys, for the status epilepticus, guys, you have to give the IV Lora Gpam, IV Lora Gpam. For the absence seizure, guys, so absence seizure is seen in the school going children. So it is the so if the age is less than 5 years, if the age is less than 5 years, you have to give the ethoxyzimide. Ethosuximide. Okay, now if the age is more than 5 years, then you have to give the sodium valproate. Okay, now the next question is, guys, for the GTCS, generalized tonic seizure, you have to give the valproate. Valproate is the first line of choice. So can you please listen here, guys? Okay, now so just listen me. Okay, so actually the drug of choice for the GTCS is the valproate. Okay, now for example, guys, okay, now because the valproate is very teratogenic in pregnancy. That's why you have to avoid the valproate. Then so for example, the female who wants to be pregnant, then she has to shift to valproate to levetiracetam, and also you can give the lamotrigine. Okay, see, female who wants to be pregnant, so she has to be stop the valproate, and she have to take the levetiracetam or lamotrigine. Okay, na? So guys, if the patient is already pregnant, okay, na, actually if the patient is pregnant and she got the GTCS, then she has to continue the valproic acid, but she has to add the folic acid. Okay, na, 4 milligram per day. Are you sure? Okay, na? Did you got it this one? Please remember this, guys. Okay, now. So guys, for the febrile seizure, it is the rectal diazepam. For the neonates, it is the neonatal seizure. It is the phenobarbital. Phenobarbital. Okay. For the infantile spasm or Salam syndrome or West syndrome, it is the ACTH. It is the ACTH. Okay. For the partial seizure, it is the carbamazepine. Okay. Drug of choice, GTCS in pregnancy, I told that it is a levetiracetam or lamotrigine. Okay, now next one. For the Jam syndrome or myoclonic epilepsy, it is a sodium valproate. Okay, see guys here for the Myasthenia gravis, it is the you have to give the either pyridostigmine or neostigmine. So guys, you have to prefer always the pyridostigmine. You have to prefer always pyridostigmine because it does not cross the BBB, that's a blood-brain barrier. So that's why you have to give the pyridostigmine. So because neostigmine is you can use neostigmine also, because and you have to always prefer the pyridostigmine, because pyridostigmine does not cross the BBB. Neostigmine is cross the BBB. Okay, so that's why you have to always choose the pyridostigmine plus atropine. Both you have to give. In the severe cases, you have to give the steroids. Okay, in the myasthenia crisis, you have to give the IVIG or the plasmapheresis. For the diagnosis, guys, you have to use the edrophonium. You have to use the edrophonium tablet, that is 10th tablet. While after taking this edrophonium, guys, the symptoms will be improved. So what is the investigation of choice? The investigation of choice is the EMG, electronic electromyography. Okay, single fiber electromyography for the myasthenia gravis. Edrophonium is only for the diagnosis only. Okay, now are you good? Got it? Okay, next one is the for the guys, for the atrial fibrillation. Atrial fibrillation, it is the beta blocker. Atrial fibrillation is the beta blocker. Okay, now. So next thing here is that if the patient is having atrial fibrillation plus asthma, you can give the calcium channel blockers. Here is the for the PSVT you can give the adenosine. For the PSVT plus asthma, you have to give the verapamil. So guys, most of you guys making the mistake is that by seeing the PSVT graph, you guys are marking the answer at the PSVT. You guys are marking the answer at the adenosine. Plus, please read the question carefully. The patient is having the bronchial asthma. They will mention. Then you have to go with the verapamil. Okay, now. Now, so guys, see here for the BPH and the symptomatic treatment, BPH and the symptomatic treatment, it is the tamsulosin. Tamsulosin also called as siloducin, or it is a siloducin. Okay, siloducin. Okay, na. For the symptomatic treatment is siloducin or tamsulosin. For the BPH and the hypertension, it is the prazosin. It is also used for the treatment of the scorpion sting. Actually, the first line is that it is the antivenom. First line is the antivenom. Then after that it is you have to give the prazosin. Okay, na. Next one is the, see here guys, for the mountain sickness, it is a acetazolamide. Morning sickness, it is the doxylamine. You have to add the B6. You have to add the vitamin B6 to avoid the side effects. Motion sickness, it is the scopolamine or hyoscine. Okay. See, for the prophylaxis of migraine, it is the propranolol. Prophylaxis is the propranolol. See here. See, if there is a obese person, okay, if there is a obese person, okay, na? If there is a obese patient, so and with the migraine, you have to give the topiramate. Okay, you have to give the topiramate. Okay, now see acute attack, if migraine, okay, in the acute attack, guys, you have to give the sumatriptan. Okay, na. For the tension headache, it is the NSAID. And also remember, guys, for the cluster headache, the first line is that you have to give the sumatriptan, and also you have to give the high flow oxygen for the cluster headache. Okay, now next one, guys, Blue Man syndrome side effect of is the side effect of amiodarone. It is the side effect of the amiodarone. Please remember this one. I also discussed about the what are the side effects of the amiodarone in the you can also see in my Telegram channel, and also you can see in the part, I think it was in the part 3 of the 150 MCQs. Okay, just see there is a gray baby syndrome. It is the chloramphenicol. See here, Redman syndrome, vancomycin, red color discretion of the urine, due to the antidiabetic is the rifampicin. pigmentation by what anti-leprosy drug? It is the clofazimine. Clofazimine. Please also remember the what is the treatment of the leprosy also, guys. Okay, I think you guys know. Okay, for the passive bacillus, okay, na, and the multibacillus, okay, now you have to know. And for the guys, see here, for the acute gout, see here, for the acute gout, you have to give the NSAID, see the colchicine. For the chronic gout, you have to give the allopurinol. It is the allopurinol. You have to remember the what enzyme it will be inhibiting the allopurinol. Okay, now. So here it is the see next one is the cardiogenic shock with oliguria. Cardiogenic shock with oliguria is the dopamine. We having the mixture. See it is the see here the further see adrenaline in the case of the anaphylactic adrenaline for the case of the anaphylactic shock it is the 1:1000 1:1000 IM or 0.5 ml. Okay, na? So 1:1000 IM or 0.5 ml. This one is given for the anaphylactic shock. Please remember this one, guys. Is always asking. And for the cardiac arrest, it is the mixer. It is the dilution is the 1:1. It is the 1:10,000. Okay, not 1:10,000 is the IV or 1 ml. And also it is the 1:1000 intraosseous. They will mention you clearly in the examination. Okay, now you have to say that it is the intraosseous. This is the IM. Okay, now next one is the for the orthostatic. It is the orthostatic hypertension. Orthostatic hypertension it is the midodrine. It is the case of the midodrine. Okay, now for the scabies, that is the for the scabies you have to, it is called by itchmite. It is called by itchmite. It is the 5% permethrin. 5% permethrin. Okay. For the flag shape ulcer, it is the metronidazole. Okay, na? It is the metronidazole. What is the flag shape ulcer? Just please comment below. Okay, I want to know from you guys. Okay, it is the flag shape. It is the Entamoeba histolytica. Entamoeba histolytica causes the flag shaped ulcer. Okay, next one is the see here is the trichomoniasis. It is trichomoniasis. It is the metronidazole. See, trichomoniasis. What are the features? It is the pink. It is the strawberry. It is the strawberry cervix. See here. See, strawberry cervix. And there is a green leaf. See, strawberry cervix, greeny discharge. Okay, na? I went to buy strawberry by Metro. Okay, na? Okay, na? I went to buy strawberry via Metro. How does Metro is running? It is a it means see it is the see what type of motility is the trichomoniasis? It is a twitching motility. It is a twitching motility. See twitching the twitching motility is seen in the trichomoniasis, and metronidazole is the drug of choice. And also, guys, for the bacterial vaginosis, it is the metronidazole, clindamycin, and also the tinidazole. Please remember these three drugs. Okay, metronidazole, clindamycin, and also a tinidazole. For the candidiasis, you have to give the fluconazole. Okay, scrub typhus. Dot. Remember dot typhus dot. Okay, doxycycline. See here for the herpes zoster. You have to give the acyclovir. How much? It is the 800 milligram every 5. See, sorry. It is the for the 5 times. Okay, 5 times per day. Okay, this is also a question. Next one is the syphilis. Syphilis painless penicillin. Okay. Next one is chancroid. Because the doxycycline. Donovanis is the azithromycin. Tuberous sclerosis, tuberous sclerosis, tuberous sclerosis is the case of the vigabatrin, vigabatrin. See here, it is the seizure. Here, what is the triad of tuberous sclerosis? I forgot that one. See, it is the seizure with the mental illness. Okay, seizure with the mental illness. It's a low IQ. It is the case of the tuberous sclerosis. The choice is the vigabatrin. Okay, see here. For the post-operative ileus or urinary retention is the bethanachol anticholinergic. Okay, for the it is a cholinergic. Okay. See, for the Sjogren syndrome, dry mouth, it is the carbachol. Cisplatin induced vomiting. Just see what is cisplatin is treatment for the chemotherapy. So, the chemotherapy induced vomiting is the ondansetron. Pregnant lady 12 weeks AOG Plasmodium vivax. Plasmodium falciparum. Okay, pregnant lady first trimester. But it is the if the pregnant lady is diagnosed with the Plasmodium falciparum, it is the case you have to give the quinine. Pregnant lady 12 weeks AOG diagnosed with the Plasmodium vivax, you have to give the chloroquine. Chloroquine. Okay, now. Okay, now in the second trimester, you have to give the artemisinin. Okay, second and third trimester. Okay, now next one is the cervical cancer. Okay, excuse me. Next one is the cervical cancer. Cervical cancer. It is the cisplatin. Next, coming to the Alzheimer's disease. Okay, Alzheimer's disease. Yeah, in the best one is the we have in the rivastatin, galantamine, memantamine. We have so many drugs. So this is the out of the best one is the donepezil. Donepezil is the best one. We are also having the new drug. It is the aducanumab. Aducanumab is the new drug. Okay, but you have to always mark the if we ask new, you mark it this one, or else you have to use the donepezil. So guys, for the Alzheimer's transdermal patch, it is the rivastatin. Okay, now in severe cases, guys, you have to add the memantine. It is the NMDA antagonist. Okay, next one is the for the Parkinson disease, guys, you have to add the levodopa plus carbidopa. It is C. It is the plus. Okay, this is the plus. Okay, levodopa plus carbidopa. See, without carbidopa, levodopa, nothing. Okay, now because you know what, for the activation it needs the carbidopa. Okay, now that's why. See, drug induced Parkinsonism. It is the drug of choice is the bench hexol. Okay, now for the Parkinsonism, it is the pramipexole or ropinirole. Okay. Next one is the nephrogenic diabetes insipidus. It is the thiazides. Example, hydrochlorothiazides. Okay. For the central diabetes insipidus, it is the desmopressin. See, can you tell me what is the other what is the other cases we have to use the desmopressin? It is the bedwetting. Bedwetting cases. Okay. First one is that you have to do the alarm therapy. Okay, na? Alarm therapy. Then after that you have to give the desmopressin. Okay. Next one is the case of pheochromocytoma. It is the phenoxybenzene. Everyone knows. And if there is a hypertension with diabetes mellitus, you can give the ARBS. This is the you give the telmisartan. Also you can give the ACE inhibitors. Also you can give the ACE inhibitors. Okay. Next one is the for the hypertension with the gout, you have to give the losartan. Okay. There is just next one is the angioedema, dry cough, side effects of it is the side effects of the ACE inhibitors. ACE inhibitors are end with pril like lisinopril. Okay, na? Okay, na? Lisinopril like pril drugs. Okay, na? Next is the for the congestive heart failure, you have to give the digoxin. What is the What is the antidote for that for the digoxin poisoning? It is the DG bind. Okay, we'll see the next one. For the guys here, for the smoking session, for a smoking session, you have to use the varenicline. Chronic alcoholism, it is the disulfiram. See here, this one is the septic shock with hypotension. It is the noradrenaline. Septic shock with hypotension. You have to give the norepinephrine. Okay, now guys, coming to the hyperthyroidism. Hyperthyroidism in the first trimester, you have to give the PTU, propyl thiouracil. Propyl thiouracil. The side effect is the agranulocytosis. Agranulocytosis. Okay, now next is the in the second trimester, third trimester, you have to give the either methimazole or carbimazole or methimazole. What are the side effects of the carbimazole? It is the aplasia cutis. Okay. Next is the if the patient has hyperthyroidism plus hypertension, then you have to give the propranolol. Okay. For the hypothyroidism, everyone knows it is the levothyroxine. Always it will be in the mcg microgram. Okay, dose will be in the microgram. Okay, next one is the for the H. pylori. For the triple therapy case, you have to give the 2 antibiotic plus 1 PPI. Antibiotics either amoxicillin or clarithromycin or tetracycline or metronidazole. Okay, na? From these four drugs, you have to give any 2 drugs. Okay, and the 1 PPI, anything omeprazole or esomeprazole. Okay, anything. And see, H. pylori, quadruple therapy, you have to give the 2 antibiotic either from this one and 1 PPI, and there is a 1 covering agent, is the bismuth substrate. Bismuth substrate for that act as the covering agent. Okay. The next one is the new regimen for the NDR-TB. It is recently approved. It is the bedaquiline, BPLC, bedaquiline, pretomanid, linezolid, moxifloxacin for the 6 months, guys. So, okay, na? To know that to know the indications and the doses, guys, I already uploading in the part 3. Just part 3 of my short questions. You can just go in there. Okay, side effects which cause the red green blindness is the ethambutol. It is the ethambutol, and the guys for the QTL and the anti-TB drugs which causes the QT prolongation, and also it inhibits the ATP synthase enzyme. It is the bedaquiline, and what is the most hepatotoxic? It is the pyrazinamide, and it is the which causes the peripheral neuropathy. It is the isoniazid. Okay. Next, for the breast cancer, guys, for the pre-menstrual women, you have to give the tamoxifen. For the breast cancer, for the post-menstruation, you have to give the letrozole. Okay, letrozole. Okay, now see, guys, for the here pregnancy with the bronchial asthma, you have to give the nifedipine. You have to give the nifedipine. Always avoid the DNB. See, diuretics, beta blockers, ACE inhibitors, ARBs. You have to always you have to avoid in the pregnancy with the bronchial asthma. Okay. Next one is the hypertensive emergency in pregnancy. You have to give the labetalol. Okay. Anticoagulant safe in the pregnancy. It is the heparin. Okay, now remember this one. It is the heparin. See, warfarin is contraindicated. Is the safe is the heparin. Warfarin is contraindicated. Warfarin is only contraindicated in only first trimester. Okay, now warfarin is only contraindicated in the first trimester because warfarin is called as the cartilaginous disorders. Okay, now this is a Conradi syndrome. Okay, then this one is the antibiotic safe in the pregnancy. In the safe in pregnancy, it is the PCM, penicillin, cephalosporin, macrolides are safe in the pregnancy. But what are contraindicated? The fats. Fats are contraindicated. It is the fluoroquinolones, aminoglycosides, tetracyclines, sulfonamides are contraindicated in the pregnancy. The next one is the hypertension safe in pregnancy. Hypertensive drugs hypertensive drugs which are safe in pregnancy, it is the LHMC Medical College. Okay, Louis something LH Medical College. It is the L-labetalol, heterologine, methyl-dopa, CCB. That is the cancer blocker. That is the nifedipine. Okay, what is this one? As one is the cardiology here. Cardiogenic shock with hypertension. With hypertension, it is the noradrenaline. For the without hypertension, it is the dopamine. Dopamine. Okay, na? See, we have in the dopamine doses. As the low dose, medium dose, and the high dose. For the dopamine in the low dose, it is the helps in the treatment of the acute renal failure. In the medium dose, it is the helps in the treatment of the cardiogenic shock. In the cardiogenic shock with oliguria. Okay, na? For the high dose, it is given in the septic or neurogenic shock. Okay. Next one is the fundoscopy in children. It is the atropine. Okay, it is atropine 1% ointment. And fundoscopy in adults, you have to use the tropicamide for the dilation. Okay, ting. See, for the overactive bladder, you have to use the Mira background. Yeah, the trospium. You have many drugs here. Just remember the Mira background, most commonly used. The next one is the ADHD, attention deficit hyperactivity. Is the methylphenidate. For the narcolepsy, it is the modafinil. It is the modafinil, which increase the norepinephrine and the dopamine, which makes us very alert. Okay. For the cystic fibrosis, it is the IVA catheter. It is the IVA catheter. Coming to the glaucoma, guys, the primary open angle glaucoma, and also for the acute closure glaucoma, it is the latanoprost. The side effect is the growth of the eyelashes and the eyebrows, and there is also case of the cystite macular edema, and there is a heterochromia. It is there different colors. Okay. And the guys, also the next one is the acute congestive glaucoma. For the acute congestive glaucoma, you have in the emergency, the congested, you have to give the IV, or the IV estrazolamide, and you have to give the IV mannitol. Okay, now remember here if there is the patient of the glaucoma with asthma, you have to give the betaxolol. Okay, now timolol is always contraindicated. Okay, see, next one is the glaucoma drug avoided in children. Glaucoma drug avoided in children is the brimonidine. It is the brimonidine because it causes the apnea in children, as CNS depression. Okay, na? But it is safe in the pregnancy, guys. Okay. Next one is the side effects of salbutamol. See, it is the tremors, tachycardia, hypokalemia, hyperglycemia, headaches. Okay. For the CML and the cyst, it is the imatinib, everyone knows. Next one is, see, hypolipidemic drug, which is safe in pregnancy. It is the regimens, example, cholestyramine. Okay, now, this one is the drug of choice for the hypertriglyceridemia. It is the fibrates, example, gemfibrozil. It is the and the side effect is the gastro and the myopathy. This is the question asked in the last FMG examination. Statins, which decrease the LDL. It is the statins. And also it is the which inhibit the HMG CoA reductase enzyme. The atorvastatin, rosuvastatin. Okay, atorvastatin, rosuvastatin, simvastatin. Okay, like this one. Next one is the vitamin used for the cholesterol reduction. It is the niacin. It causes the increase in the HDL and decrease the lipoprotein. Okay. Next one is the guys. Safest DPP4 inhibitor, it is the linagliptin, it is the anti-diabetic drug. Okay, see Lena. Okay, Lena. See, I will discuss about this very clearly in the upcoming slides. Okay, don't worry about this. Okay, so next anti-diabetic drug which causes unexplained diarrhea is the metformin. It is also the PYQ. Next one is the CMV retinitis. There is a pizza-color appearance of retina. This is the ganciclovir. Hepatitis B is the tenofovir. The resistance to acyclovir, ganciclovir is the resistance. It is the post-carnate. Influenza virus, it is the oseltamivir. Okay, the neuraminidase inhibitor. It is the For the liver fluke or hepatic, fascicular hepatic, this is the triclabenzyl. Guys, remember this. Almost all there are similar. There are going to be similar drugs. The only is the fascicular hepatic it is having the only the different. It is the triclabenzyl. Remember this only one in the microbiology is the triclabenzyl. For the phenylacetones is the diethyl carnazine. Okay, citrate. For the Bell's palsy it is the steroids. For the osteoporosis it is the bisphosphonates. Example, all the drugs will end with dronate. Example, alendronate, elundronate. Okay, for this one. Next one is for the ectopic pregnancy psoriasis it is the methotrexate. It is the DFR fluororeactase inhibitors. It is the methotrexate. Okay. Next one is for the neutropenia you have to get the filgrastim. For the OCD psychogenic premature ejaculation you have to get the fluoxetine. Bipolar, lithium, sleep cycle maintenance is the melatonin, and the DK you have to get the regular insulin for IV fluids. For the hyperprolactinemia you have to get the bromocriptine. For the galactoria you have to get the cabergoline. Okay, now. So let's discuss about the TB drugs. See here, guys, TB drugs which is the first one is isoniazid, which causes the peripheral neuropathy. The rifampicin, which is causes the reticular dysplasia, and the pyrazinamide is the most hepatotoxicity. Ethambutol, it is the red green blindness. Delamide, pretomide, it is the mycolic acid, mycolic acid selvard inhibitors. Side effect also is the QT prolongation. And also please remember the bedaquiline. I think I already discussed about this one. Bedaquiline, it is a ATP reductase inhibitor. Okay, na? It also the side effect is the QT prolongation. Okay. Bedaquiline is the ADP synthase inhibitor, but it is the delamide and protamide is the mycolic acid selvard inhibitors. Okay. Next one, coming to the antidiabetics, guys, very important. One MCQ for sure. Guys, see here we have the DPP4 inhibitors. See all the DPP4 inhibitors are gliptins, sitagliptin, vidagliptin, vildagliptin, linagliptin. All the names are starting with the girl's name. See, Sita Mata, Sita Mata, Lina Mata, Saksha Mata. Okay, na? So that's linagliptin is very safe in the CKD patient. Only lina is safe in the CKD patient. So SGLT2 inhibitors, guys, all the drugs will be, it is the flogin drugs. Flogin is dapagliflozin, empagliflozin. Okay, na? See here, it causes the loss of the glucose in urine. So if there is more loss of the glucose in urine, guys, what happens? There is a chance of the increased growth of the bacteria. That's why there is a side effect increase the risk of UTI, genital mycotic infection, foreign gangrene, and weight loss. Okay. But that's the big one. I think very much it is the metformin. It's called non-hypoglycemic, and it is a side effect is the vitamin B2 deficiency. Certain areas it's most hypoglycemic. Last portion. Then glipizide, glimperamide. Okay. This one is thiazolamides. It is the example is the pyroglycazone. Is a PPAR gamma activator. Risk factor is the bladder cancer. It is the bladder cancer. Okay. Next one is the GLP-1 agonist. GLP-1 agonist is the liraglutide. It is the drug of choice for the obesity. Next one is the alpha glucose sidase inhibitor. It was not used alone. You have to give it with the combination. It was taken between the meals. Okay. The example is the acarbose. Remember the antidotes. It was OPC. It is the atropine. It is the atropine rat killers. No need. This one is just paracetamol. I think everyone knows the ancestral cysteine, warfarin is the vitamin K beta blockers. We have benzodiazepine is important, Fmge, methanol is important, opiates are important, and atropine is important, cyanide is sulfuric acid, no snake bite, everyone knows about this one. This one, guys, remember this one, digoxin, digibine, immune F antibody, heparin, MgSO4, iron. See here, iron we are having the acute stage here and the here in the acute in the acute you have to use the desferrioxamine. In the chronic you have to use the deferiprone. Okay, na? Please remember this. Please remember this. Remember the antidotes. Okay. I hope no more doubts. I think I covered all the important points from the pharmacology, guys. Okay, na? So also you have to read about the antiplatelet drugs. Okay, antiplatelet drugs. Antiplatelet, they are also they're always giving the one is the apixaban. See, apixaban. This on the suppose example again this is the this one. This is the apixaban. This is the antiplatelet. See, apixaban. This is the 10. This is the factor 10 in. This is the factor 10 inhibitor. See, apixaban X is it's like a 10. Then it is the factor 10 inhibitor. Remember this one. This is the I was asking the question from the antiplatelet drugs. I think everyone knows the aspirin low dose and the high dose. This is from the antiplatelets. And I think that's all, guys. They're asking about the maximum. All the questions are asking from these only, guys. Okay. If you have any more questions, you can just ping me on my Telegram. This is my ID. My ID is the omeprazole 40 milligram. Okay. Okay. My Telegram. You can also text me in my Instagram. Also, it's the same omeprazole 40 milligram. Okay. Dr. Omeprazole 40 milligram. Okay. Thank you very much. Wishing you all the best. Please, after the exam, after the results, don't forget to text me that, bro, I pass. So, okay, na? This is going to be very, very biggest gift for me. Okay. Thank you very much, guys. Take care.